India has seen over 1.6 lakh COVID-19 cases in the last 24 hours. This is the 7th day in a row when India has recorded over 1 lakh cases. The healthcare system is clearly overburdened with more than 12.5 lakh active cases of COVID in the country right now. The Health Ministry estimates suggest that there are 5 states currently accounting for 69% of the active caseload in the country. Now, Delhi has seen a worrying spike of over 13,000 COVID-19 infections in the last 24 hours. The Delhi Chief Minister has said 65% of these are aged under 45. Remember, this is the age group that is not yet eligible for the vaccine in India. The Delhi government has announced that 14 private hospitals in the city will be made fully COVID-19 hospitals. These hospitals have been asked not to admit any other patients. Is this the only option that is left for cities like Delhi, which are seeing over 13,500 cases? What happens to non-COVID care? What should you do at the moment if you have a health emergency that is not COVID related? We look to answer all of those questions. But first, let's just get in a perspective from our panel of expert doctors. We have Dr. Rahul Pandit, member of the Maharashtra COVID Task Force, joining us. He's also Director of Critical Care at the Fortis Hospital. We have Dr. Sarman Singh. He's joining us from Bhopal in Madhya Pradesh. He's the Director of the All India Institute of Medical Sciences in Bhopal, also a Senior Virologist. Dr. Singh, if I can begin by asking you, one of the worrying features of the second wave of COVID is the proliferation of the infection to rural areas, Tier 2, Tier 3 towns. Let's just look at Bhopal and Madhya Pradesh in particular. It's one of the states that has recorded the steepest rise in COVID-19 infections.
Yeah, you are right that this time this wave is really very fast, and the peak we don't know that when we will achieve the peak, but definitely the number of cases rising, the speed of these cases is really tremendous, irrespective which state. Most of the western states, including the Gujarat, Madhya Pradesh and Maharashtra and now Chhattisgarh also, all 4 or 5 states, they are really facing the huge brunt of this virus. And there are many reasons for that, of course. And then, as you already said, that this is also not limiting itself to the big cities, but also it going to the major, minor cities and the towns and the rural areas also. And also in the younger age group, that is also worrisome for all of us.
In fact, Dr. Singh, the Delhi Chief Minister just a short while ago has talked about how 65% of COVID cases in Delhi are now being seen in the age group of under 45. I want to understand from you, you're also a senior virologist, is the new mutant strain that is being found here in India, is it behaving differently from the previously known strain, and how?
There are, both, host, when we talk host means the humans as well as the virus, both are responsible. The one, as you said, that the virus also has mutated, and we know that UK UK variant is more pervasive, and it requires less number of viruses to infect. And this is, also some of the mutants, they are also adhering very quickly to the receptors of the cells. So that is also from the virus point of view, we can say, that is making this, speed of infection very fast. Also, the second wave, the complacency in the youngsters became responsible also, that because these groups, they obviously they are, they go for job or other venues, and the cinema hall, the restaurants. So that is also, they are also exposing, and on top of that, the virus has mutated. So that is a two, the best fit, what we say, best fit means the parasite, means the virus is also mutated, and the host, they are also exposing themselves more.
All right. So it is essentially a double whammy from what one can understand. Dr. Pandit, if I can come to you, Maharashtra, of course, has continued to remain the top focus, given the fact that it has seen the steepest rise in infections and deaths. Initially it was believed that the second wave of COVID may not be as deadly. Do you believe that concept has now changed, given looking at just the number of deaths in Maharashtra in the last 4 weeks?
Rishika, as you rightly said, this is the steepest rise which probably any other country has seen in the second wave, which Maharashtra and India is actually witnessing right now. And coming to the deaths, the case fatality ratio is still below 1%. In fact, Mumbai has creeped up from 0.2 to 0.45 or 48 yesterday. So it is creeping up gradually. The problem is that the vast number of cases, the large number of cases which are coming positive, and we will actually have an absolute number of patients who have died, which will be very, very big, even if the case fatality ratio remains below 1%. And the fact is that when you have 11,000, 12,000 people coming up, 11,000 people coming up positive in Mumbai, and if it is only 0.5%, still it is a very, very big number which we are looking at just from Mumbai and then from the state, of course. So I really don't think that the fatality has actually changed with the virus. I think it is still the same. It is just as much fatal as it was before. I think that's probably a myth that we were thinking that this virus is less fatal or less likely to cause severe disease. What has changed definitely is that this virus is not causing the severe disease or mortality in patients who have been vaccinated. So that is reassuring that patients who have had 2 doses of vaccine and have completed the 3 weeks or 2 weeks after the second dose, they are getting an asymptomatic or a mild disease only, which is a very, very reassuring fact. And that's the only silver lining in that. And the message here would be get everyone as quickly vaccinated as we can so that we can actually prevent deaths.
Look at the statistic that's been presented in Delhi, Dr. Pandit, and are you seeing a similar trend in Maharashtra? That will also actually be very interesting to watch out for. Over 65% of the infections in Delhi, for instance, are below the age of 45. That's the category of the working population that is not eligible for vaccination yet. So do you believe that apart from vaccinating as many people, we also need to maybe shift our focus to vaccinating the working population in order to flatten the curve?
So all of us doctors have actually been saying that it is not the old people who were actually getting vaccinated who are spreading the current wave which is happening. As Dr. Barua said, that we were saying this for a long time, that population which was young, which was going out, was traveling the local trains in Mumbai, was in the buses, was actually responsible for bringing the infection home and perhaps getting the old infected, and they were getting infected themselves. I see the same trend in Maharashtra as well. I think it is the younger population which has got infected the most. A lot of patients who are in the hospital are also in the young age group, and a lot of patients in care areas are also in the younger age group. So we need to definitely bring down the vaccination age to a age perhaps at 25. Obviously, it depends on how we can bring up the stocks of the vaccine.
Okay. So you're saying that India needs to revise its strategy to start inoculating population aged above 25. That's a very important point that you're making. Dr. Joyita Basu, co-founder and director of Doctors Hub, is also joining us from the National Capital Region. Thanks, Dr. Basu, for being with us. You've been writing extensively about the second wave being particularly more dangerous than the first wave, exponential rise in infections, younger population being infected. I want to ask you, given the fact that the younger population is, going to work, how can you prevent it? Say, you've talked about, interestingly, the use of a double mask instead of one mask. Is that something that now needs to perhaps be made mandatory?
I think so, because many masks, they don't fit perfectly on the face, if you've seen. So most of the time they slip down from the nose, from the mouth. So a double mask with a perfect fit, with a nose brace, would be the best way to prevent getting the virus catching the virus from other people, especially if you're in a crowded place.
And does an N95 mask suffice? Can one N95 mask replace 2 cloth masks or surgical masks?
Absolutely, one single N95 mask can replace 2 surgical or 1 surgical, 1 cloth or 2 cloth masks, definitely.
All right. Dr. Nangia is also with us. Dr. Vivek Nangia is the Principal Director and Head of Respiratory Critical Care Medicine from Max Saket. Dr. Nangia, I want to just shift our focus to Delhi particularly because, over 13,500 infections in the last 24 hours is a very worrying figure. The government, in its wisdom, has now decided to dedicate more beds, more ICUs to COVID-19. 14 private hospitals, and we're putting out that list on our screens for the benefit of our viewers, have been dedicated to COVID. But what happens to non-COVID care?
So that is going to be a huge challenge for us to manage the non-COVID patients now, especially the ones which are coming like an emergency. You know, the elective ones can definitely be deferred for the time being. Somebody wants to get a gallbladder surgery, somebody wants to get a knee replacement done, which is not causing much pain right now, should probably be deferring those kind of surgeries right now. But definitely when it comes to an emergency, it becomes very, very tricky and challenging for us. It's important to keep them separated from the COVID patients also, you know, at the same time. So unless you have dedicated hospitals, it becomes difficult to manage these kind of emergencies.
Also, Dr. Nangia, one of the commonly asked questions is, you know, the hospitals that have been dedicated to COVID, 4 major government hospitals, 14 private hospitals dedicated to fighting COVID-19. What about emergency services in these hospitals? If a COVID hospital is the closest to your home, for instance, but you have a non-COVID emergency, will you still be able to seek admission?
So I don't even think it would be wise to seek an admission in a COVID hospital, because there already you have all COVID patients, and probably they would not be able to segregate them, segregate the COVID from the non-COVID. So that would not be a wise decision. I guess you'll have to move into a nearest hospital where there are non-COVID facilities, which would definitely be better and safer option.
Dr. Basu, I want to ask you as well, because you're also a practicing doctor in the Delhi NCR region. How do you look at this decision of reserving private hospitals exclusively for COVID-19? Do you believe it's the absolute need of the hour?
At present, we are completely overwhelmed. There are no beds anywhere. There are no ICU beds anywhere. So we have to find beds somewhere, number one. Number two, elective surgeries can wait. Emergencies have to be taken care of. So it's best to distinguish between the two of them, because if a patient who is non-COVID comes in contact with a COVID patient, chances of him getting COVID is very high. So you have to differentiate between the two differently, and we are overwhelmed. So we do need to ramp up beds. We do need to ramp up ICU facilities.
All right.
I mean, there's no other option that we have.
Okay, so no other option, and also the experts on the panel at the moment recommending that if there is an elective surgery that can perhaps be postponed, you are better off postponing that surgery given the exponential rise in COVID-19 cases. I want to now shift our focus to the other big story and the good news really that we're tracking, which is the approval of a third vaccine for COVID-19 in India. The Russian-made Sputnik vaccine has been approved for emergency use. It's going to be manufactured by 5 pharma units. 850 million doses are going to be produced annually. That's the target. However, only a limited number of doses will be available by the end of April or by the beginning of May. It's going to be is being manufactured rather by Dr. Reddy's. And it has the highest effectiveness so far for a vaccine that's been approved in India, which is 91.6%. This is the highest after the Moderna and the Pfizer shots. We still need to give 2 doses, 21 days apart. Let's get in, our panel of expert doctors to comment on that. Also, an interesting development that's taken place moments ago. The government has now decided to fast-track emergency approvals for foreign-produced COVID-19 vaccines. So if a vaccine has not essentially had a clinical trial in India, is not being produced or manufactured here in India, it could get a fast-track emergency use authorization. So this is also a very significant development. Let's get in our experts, to weigh in on that. Dr. Singh, to you first. How do you look at, this sudden push to grant emergency use authorizations to more COVID-19 vaccines? And do you believe the Russian vaccine, presents itself as a ray of hope at the moment?
Yeah, actually this demand was long pending, and the people were, they were discussing, the experts also, they felt that, why those who have, they cannot have the vaccine, who can pay, who are rich enough, they can pay and they can arrange the vaccine, they should be allowed. This is a democratic right they have. So this was, dilemma government was having, and ultimately probably they have agreed to that without, the clinical trial, which has to be seen that how the DCGI takes it. But definitely Sputnik, as far as concerned, I think this is a wonderful, moment, that Sputnik is very effective vaccine, very less or rather minimal side effects, high efficacy, and because the technology is also unique for that, because the first vaccine has different mechanism, second vaccine, the booster has different mechanism. So that is also, this is one of the best, and as we know that the president of the Russia was the first person And
Yes.
in fact, he allowed his daughter to take it first.
This
So that is
revision of strategy though, and Dr. Reddy's had actually applied for the emergency use authorization of Sputnik back in February. Dr. Pandit, do you believe that this delay was unwarranted? We should have gone ahead and approved it sooner. Even this center now paving way for more vaccines that have been approved abroad to be, to be allowed in India, for instance. Do you believe this should have happened sooner?
No, I don't think we should have a needle of suspicion there. I think the DCGI and the expert committee must have taken due diligence. After all, they are launching a drug which is very, very new in the world altogether. While the trials have been done outside, they need to go through the data, need to be convinced that if they are going to offer it to the 1.3 billion population of the country, it is as safe as it has got to be. So I don't think we should have a needle of suspicion. They took their time, and as soon as they were probably convinced that it is safe and it is effective, they have given the approval. I think we should look at these things in a positive way. We could always say that it could have been approved 4 weeks ago, or maybe, we could have done it a few months ago. But those are all things which I don't know what is happening in the room when they are actually looking at the data.
Right.
So they must be going through a lot of information before coming to this decision.
Okay.
I just want to say one more thing. What Dr. Basu said about the mask, I completely endorse the double masking. But N95, leave it for the healthcare professionals, please.
Yes.
If people start using N95 at home, we will run out of N95 masks, and doctors and nurses and healthcare professionals and frontliners will be left high and dry.
Okay.
Already the demand is huge,
Yeah.
and we are seeing a huge demand now coming across the country because cases are spurted up everywhere. So N95 only for frontliners, and rest of them should be having double masks.
Okay, so wear a double mask, not one but 2 masks is what doctors are recommending. Dr. Basu, coming to the point of vaccines, once you've been given the first shot, or even if you've been given both shots of the vaccine, can you go back to wearing one mask? Would you still recommend that, the immune escape mechanism of the new strain is something that's been spoken of? What would you recommend to patients who've taken the vaccine?
You have to remember that the vaccines show 91%, 90%, 76% efficacy. So you have to be very, very careful. You could be falling in the rest 10% or the rest 20% where the vaccine does not show any efficacy. So you have to continue to wear a mask even after getting fully vaccinated. It is very, very important. CDC does say that people who have got both doses of the vaccine, meeting other people who've got both doses of the vaccine, may remove their masks in a closed environment. But looking at all the variants around the world, I would say continue to double mask.
All right, continue to double mask is a message.
Yes.
Dr. Nangia, important question, because a lot of our viewers have also been writing in to ask which vaccine is better. So far, they've had to choose between 2 vaccines. There's now a 3rd vaccine entering the market. And with the government clearing the way for vaccines that have been given emergency use authorizations in other countries to enter India without a trial, one hopes that there will even be more. How do you gauge what's best for you?
So I think it's the concept of the more the merrier kind of a concept, where you can pick and choose which one you want.
Okay.
You basically have to see, my criteria of recommendation would be whether you're allergic to any particular component of any of those vaccines or not. As far as efficacy is concerned, whether it is 70%, 80%, 90%, that's all theoretical. For you, it is either 0% or 100%. Whether you fall into which bracket will depend on your destiny and your own immune response, whether you respond well to the development of antibodies following the vaccination or not.
Okay. But Dr. Singh, very quickly, one vaccine at 70%, we're putting out the comparison on our screens, one at 80% and one at 92%. Don't you anticipate that there'll now be like this mad rush to prefer the Russian vaccine over the other 2?
Yes, I anticipate. Everybody will anticipate, but I think government has to do something. This is going to happen, and once the Moderna and the Pfizer, they are allowed, then everybody, those who can afford, everybody will rush to these, and probably I am afraid that not many people, they will go for Covishield and other vaccines.
Dr. Pandit, which way would you weigh in?
I think the child is just getting better at syllabus, 70%, 80%, 90%. I don't think we should count that. I am completely with Dr. Nangia. We should take the vaccine which is coming our way. It is the first year of vaccination. Let's send a very clear message to the viewers. Take the first vaccine which comes your way. 10
seconds. Dr. Basu, should you just take the first vaccine that's available to you, not look at any of this data?
Absolutely. First thing is get vaccinated as soon as possible. So go for whichever vaccine you get.
All right. Well, thank you so much, doctors, for joining us with your perspective. A lot of interesting developments have taken place. Just moments ago, the centers, in fact, cleared the way for use of vaccines that have been granted emergency use authorizations by other countries. So essentially, vaccines, irrespective of whether they've had clinical trials in India or not, now can potentially enter the Indian market. How does this play out? We'll track the story very closely. Thank you all, doctors, for sparing your valuable time and being with us on the show. We're slipping into a short break. We'll be back with more on the other side.